It's another day at the mall. Drivers find a slot to park, switch off their cars, unload the kids, and make their way into the mall. Except for one thing. They mask up first. A global pandemic grips the planet that has killed more than 340,000 Americans and more than 1 million people worldwide. For Michael Kilkenny, physician director of the Cabell Huntington Health Department, making sure people take COVID seriously fills his every waking hour, especially as it's possible to catch COVID anywhere and at any time.
I couldn't imagine it being much worse than it's getting. It took us months to get to 700 cases, and we had 700 cases the week before last. It's really expanded greatly, and we have rapid transmission all through the community right now.
Infections and COVID deaths are rising everywhere. Hypervigilance is essential for survival, for loved ones and ourselves, said Kilkenny. Yet with COVID vaccine shots now being rolled out, protection against the virus will be increasingly possible, he said, as vaccinations become commonplace.
Priority protocol involves first-line healthcare workers because we know that they're going to need immunity to get through this surge. And then those people who are older and in congregate living situations like nursing homes. The general population, I think, will attack from the top down in terms of age. So I would expect that we might see 80 and above, or 65 and above, or 50 and above, and that it may come down stepwise as we get more and more vaccine available.
Even as vaccinations raise hopes of reducing the death toll, COVID testing for young and old continues on a daily basis in the health department parking lot in Huntington, West Virginia.
I think that I need it because it's a dangerous time to get it, and I have more chance of not getting over it easily.
My husband tested positive on Friday. He got sick on Thursday, so he tested positive, and then the health department said to wait so many days, for us to get tested, so here we are.
I think it's important because you're around a lot of people, you're around more people than you realize who have health conditions that they might not even know about or know how serious they are. And so just to help other people, we should do it and be responsible.
We caught up with Brittany Bays, who works in an office at the local VA hospital and has received a vaccination shot already. As the parent of a 6-year-old, she is fiercely protective of her child getting infected and possibly suffering lifelong health problems.
I don't want him to have caught it early on and me not know about it, and then there be long-term effects that we don't know about. As far as concerning, I know there was, in New York, there was a study on brain swelling with it. And I don't want that to have an effect on his cognitive abilities or anything like that.
I asked Bays, as someone who works at a hospital, what she would say to people not wearing masks in public or who wear them off their noses.
Well, I understand the frustration. It's not fun. But it should only be like a temporary thing. It might go into next year, but it will be over and you could save, just think about people that you're saving lives for. It would be devastating for you to find out that you're a cause of somebody dying or getting really, really sick than to have been a little bit of discomfort for you.
I was working hard not to get COVID. My mother has COPD, and I was very concerned about that. So we were washing hands and wearing masks and socially isolating and doing all the things that you're supposed to do. And I woke up and I just didn't feel right, and I had a headache. And I'm losing my mask here. I had a headache and a little bit of trouble, out of breath. I went up the stairs and I was out of breath.
She had feared her mother might get COVID, but was extremely careful and so was surprised when she was diagnosed. She believes she got the virus from her mother, who she thinks likely got it at church. They both had mild cases, except hers was like a cold that never went away. A recent doctor's appointment underscored how even a mild COVID infection can leave bad news behind.
I had my mother in the hospital for something unrelated just here this past month, and she has been newly diagnosed with heart failure. And her primary physician tells us it's probably COVID because she had never had a problem before. I'm a little angry because people aren't taking it seriously. They won't wear a mask. It's become almost a political statement as to whether you wear a mask or not. I mean, for me, it's simple science. It's simple watch out for your neighbor.